So when we look at the degenerative process that goes on in the lumbar spine, I always talk about two things when it comes to what happens. So you've got, obviously you're looking at the bone here, which is the white part, and in between on an x-ray you see a gap which represents the disc space between the white parts. On an MRI you'd be able to see the soft tissue as well, so you would see the disc itself. Sometimes it demonstrates wear and at times tearing, where the annulus pulposus or the annula can become torn, can leak. Sometimes it stays within the contents of the disc, sometimes it can extrude and enter into the spinal canal, and that can cause very, very big problems. That's an extreme case, but really what we're looking at here as to show you what can happen is the space between the white parts, the disc's space, actually shows quite a significant reduction in these examples. So the degenerative process of the disc goes on here, and then we also see changes on the bones themselves. So the vertebral bodies, on the front of them you get these osteophytic growths. Degenerative arthritis can develop. It can develop off of the back of the vertebral bodies and push in to the posterior longitudinal ligament. It can enter into the spinal canal and cause problems with the nerves. So here you can see a smoother outside on the vertebral bodies. Gradually you see the sharpened osteophytic spurs, as I just talked about, and they're growing, and here in this last example quite a marked difference from the starting position. There's two things, those two things in particular can cause what we would say radicular pain, sciatic pain. And we've got pain that radiates all the way down past the knee into the lower limb and into the foot, causing numbness, tingling and weakness. And what we do as part of the assessment when someone is to come in is to make sure that the reflexes are working properly, the strength is working properly, and we'll check sensory innervation with a toothpick and a cotton bud over certain dermatomes to make sure that that's within normal limits as well. Then we'll do other orthopedic tests. I've done lots of videos of them over the years. So what can happen is the muscles, the other type of sciatica, what you would have in a test would be muscle strength that is good. You first of all wouldn't have symptoms below the knee, any sciatica. When it comes to an assessment you have good strength, good nerve innervation and good reflexes both sides. So the sort of sciatica that can be caused by that, most often than not, is where the muscles are tight, the nerves pass through, and it can mimic sciatica caused by radicular pain, but it doesn't go below the knee. And what happens is the muscles get tight, they pinch on the nerves that pass through. And also what you can get is inflammation and dysfunction in the joints, and cartilage can wear out, and you can get facet dysfunctions, which can give symptoms of sciatica too. So that's what we'd look for. When you come into the Croydon Sports Injury Clinic, all of this will be explained depending on what the person presents with in an assessment where we go through the history, we do an assessment, we check the muscles, the innervation, the nerves, we give a diagnosis, that's explained, and the sort of treatment if indicated. Sometimes we need to refer for tests, MRIs, CTs, X-rays, etc. And exercise rehabilitation is always a component that we try and introduce as soon as possible for many of the people that present. So contact us, Croydon Sports Injury Clinic, on the website. The phone number is 0208 651 4439. Drop us an email, ask for some advice, and hopefully we will be able to help you very soon with whatever condition it is that you come in a musculoskeletal sense. Thank you very much.